As long as humans and their animals have suffered from disease, chemical substances have played a role in their treatment. Substances obtained from plants and animals or their products were used according to precise prescriptions through antiquity. The mechanism attributed to why these substances were effective are deeply rooted in the beliefs and mythologies of each culture, as were the rituals involved in their preparation. The early history of pharmacology parallels human efforts to compile records of ailments and their remedies. The earliest record compilation of drugs, the Penshao, consisted of a list of herbal remedies compiled in the reign of Chinese Emperor Shennong in 2700 BC. The ancient Greek philosopher-physicians of 500 BC taught that health was maintained by a balance of humors, which were affected by temperature, humidity, acidity, and sweetness, rather than the direct actions of gods or demons. Hippocrates was an ancient Greek physician of the age of Pericles. He is referred to as the father of medicine in recognition of his lasting contributions to the field as the founder of the Hippocratic school of medicine. The first true Materia Medica, a compilation of therapeutic substances and their uses, was compiled in 77 AD by Aristotle's student Dioscorides. Way before the age of Pericles, classic examples of medicinal use of chemicals, herbs, and other natural substances are found in the recorded papyri of ancient Egypt, such as the Ebers Papyrus, which is written in the 1150 BC. As the Dark Ages descended upon Europe, such scholarship transferred to Byzantium, where in fact a veterinary compilation for farm animal treatments called the Publius Vegetius was compiled in the 5th century. It took until the Renaissance to awaken the spirit of discovery in Europe. The Swiss physician Theophrastus Bombastus von Hohenheim, known as Paracelsus, introduced the clinical use of laudanum and a number of tinctures or extracts of various plants, some of which are still in use today. He is remembered for using drugs for specific and directed purposes, and for the famous dictum, quote, "All substances are poisons. There is none which is not a poison. The proper dose separates a poison from a remedy," end quote. As these practices took root, official compilations of medicinal substances, their preparation, use, and dosages started to appear in Europe. These publications, termed pharmacopoeia, provided a unifying framework upon which the pharmaceutical sciences emerged. The history of pharmacology parallels the development of modern medicine and the realization that specific natural products and substances may cure specific diseases. The term pharmacology was applied to the study of Materia Medica by Dale in London as early as 1692. However, it is generally regarded that the biochemist Rudolf Buchheim in the Baltic city of Dorpat established the first true experimental laboratory dedicated to pharmacology in the mid-18th century. The development of veterinary pharmacology generally paralleled to that of human pharmacology. The formal discipline of veterinary pharmacology has its origins in the establishment of veterinary colleges and hospitals in France, Austria, Germany, and the Netherlands in the 1760s as a response to epidemics of diseases such as rinderpest that decimated animal populations throughout Western Europe. In these early colleges, teaching of pharmacology in veterinary schools was essentially Materia Medica and remained closely aligned with parallel efforts occurring in medical schools, especially when colleges were located on the same campuses. The history of veterinary pharmacology has been reviewed by Lees, Fink-Gremels, and Tautane in 2013. They reviewed the past history and current status of the science, particularly the developments in the last 35 years. The authors analyzed publication data and showed the tremendous increase in scientific articles focusing on the veterinary pharmacology since 1975. The important event, which fully shifted veterinary pharmacology from one focused on materia medica to the actual science of pharmacology, was the publication by Professor L. Mayer Jones in 1954. From this point forward, veterinary pharmacology positions have existed in colleges of veterinary medicine throughout the world, the structure of which are often a reflection of local university history, priorities, and academic structure.